So interstitial cystitis is a disease process that we don't know a whole lot about, but we're getting better and better every day. It primarily affects women, but also men as well. Why does it happen? We're not 100% certain. Some people think it has to do with too much histamines in the bladder, in the blood, possibly autoimmune related as well. But the primary issue is going to be 6 months of bladder pain in the absence of infection. So after we rule out essentially everything else, we know there's not an infection, and we go and we do a cystoscope sometimes and take a look inside the bladder, and it's relatively normal, but people are still having these symptoms. That's where we generally land on as interstitial cystitis. It can be quite frustrating for patients, honestly, because people think that they're not having an issue because sometimes there's nothing tangible to latch onto. And so I oftentimes will see patients, after a year, people have been telling them they have a unrelenting urinary tract infection when in reality it's interstitial cystitis. And they're going to get all the antibiotics in the world for months and sometimes years, and they're never going to get any better. And then I see them, we start some of our treatment pathways, and finally there's kind of a light at the end of the tunnel. It's tough. It's tough, honestly, because you go to a doctor and you trust that they're going to make the right decisions and know the right calls. But, we're infallible. We're human. And so sometimes you have to advocate for yourself. If you don't feel right and you've been telling that your urine cultures are negative, but you're still just uncomfortable and something's not off, then, potentially that could be the issue. So you sometimes need to see a specialist in this field, of which I happen to be. So we have a lot of, weapons in our arsenal with regards to these kind of things. There are rescue treatments that we can do. There's different types of drugs that we have access to. We even have surgeries such as, cystoscopy with hydrodistension, or essentially we, put a camera in, we stretch the bladder, which we don't really know why it works, but it does. There is some thought process that, by affecting the nerves in the bladder and by stretching it allows for better capacity, longer wait times between urination voids, and less pain, which is really what people want. We also have certain devices that we can use, such as Axonics or Medtronics, which is an implant. Essentially, it's a little battery that we implant into the back. It sends a signal to the bladder and helps out with pain, frequency, and urgency. And that is, an indicated method for interstitial cystitis. And then also, Botox. We can inject Botox in the bladder, which can help too. A lot of subspecialties have the ability or access to these things. We have a lot of access to devices such as Axonics and Interstip, which can help out with interstitial cystitis. It's a third-line therapy indication for this disease.